Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of Alzheimer's disease. Now, how are you going to treat the Alzheimer's disease? Alzheimer's disease can be treated by the drug donepezil is actually the drug of choice for treatment of Alzheimer's disease. Mechanism of action of donepezil is this donepezil will inhibit the enzyme cholinesterase. Actually, this Alzheimer's disease occurs mainly due to the decreased acetylcholine in the brain or in cerebral cortex is responsible for Alzheimer's disease. Now, this donepezil will inhibit cholinesterase, which actually converts acetylcholine to acetate and choline. Now, because it inhibits the cholinesterase, now this conversion of acetylcholine to acetate and choline does not occur. So, as a result, there is increased acetylcholine levels are increased in the cerebral cortex. So, thus, this donepezil will increase the acetylcholine levels in the cerebrum. Then we also have some other cholinesterase inhibitors which can be given, like we can use rivastigmine or galantamine can be given. These two are cholinesterase inhibitors. We have one more drug which is called as mimentin. Mimentin. Then this mimentin is actually used to treat, it is used to treat either moderate or to severe Alzheimer's disease. Mainly it is used to treat moderate to severe Alzheimer's disease, and this mimentin will actually act on the glutamate system. It acts on glutamate system, and it will block the receptors which are called as NMDA receptors are blocked by the mimentin. Right.
thank you and thank you for watching.